So joining me on stage shortly, well, actually right about now, I have the lovely Miss Karen Shanlong Brooks from the Canadian Blood Services. She serves as the Diversity, Equity, and Inclusion Associate Director, and she'll be moderating the next session and introducing our panelists. Over to you, Karen.
Thank you so much. It's such a pleasure to be here today. And as you said, my name is Karen Chinalium Brooks, and I'll be the moderator for the Equity, Inclusion, in Blood Donation session today. I am the Associate Director of Diversity, Equity, and Inclusion at Canadian Blood Services, who is one of the sponsors of the summit. On our panel today, we have a number of esteemed guests from a variety of organizations across Canada who serve or support the sickle cell community in Canada. I would like to start by introducing Dr. Eloise Tang, who is the Vice President of Inclusion, Sustainability and Engagement at Canadian Blood Services. Since the start of her career at CBS in 2023, Dr. Tan has been working to meaningfully enhance inclusion initiatives through the sophistication of employee data and by advancing CBS's diversity, equity, and inclusion strategy, from ideation to meaningful action. Eloise is an award-winning researcher and an active community leader. She currently serves on the board of directors for Jane Finch Center and has over 15 years of experience in policy development, DEI, and engagement through senior policy roles with the Government of Ireland's Department of Further and Higher Education, Ontario Council for Articulation and Transfer, and Employment Social Development in Canada. Rugi Jalal is a dedicated advocate for sickle cell disease. Her enduring commitment stems from her family's personal journey. She lost a sister and a number of family members from complications of this disease. Rugi is the co-founder and CEO of the Sickle Cell Disease Association of Canada, Atlantic Canada, and a co-founder of the Sickle Cell Disease Association of Canada. She also supports sickle cell groups and initiatives in her native country of Sierra Leone. Rugi has also participated on the national team that successfully advocated for Bill S-211, respecting National Sickle Cell Awareness Day in Canada. Then we have the lovely Tanya Elise. Tanya is a sickle cell advocate and caregiver who passionately serves the sickle cell disease community through various hats at SAGO, including the Southern Eastern Ontario Region Coordination, advocacy via the Patient Advisory and Advocacy Council, and French translation. As a caregiver, Tanya is also part of the Parents and Patients Advisory Council for Sickle Cell Disease at Children's Hospital of Eastern Ontario, and serves as a liaison between Ottawa's community partners and SAGO. You can learn more about our fantastic panelists by visiting the summit's website. So before turning it over to Dr. Tang and inviting the wonderful ladies to join me here on the stage, I would just like to go over some housekeeping rules with you. So, as I mentioned before, we have three wonderful panelists who have been invited to speak. Each panelist, I'll be giving them 15 minutes to speak. And once they have spoken, I'll be opening up the floor for questions from the audience. At this time, I'd like to ask the members of the audience as well to turn your phones to silent so we can appreciate and hear all that our lovely panelists have to say. So we'll start off by inviting Dr. Tan, Tanya, and Rugi onto the stage.
Hello, everyone. Good afternoon. The red blankets are they're like I hope lots of pictures are being taken today because they're quite striking in the audience. I'm very happy to be here again at the SCAGO Summit. Before I start, I just want to thank Lanry and her team so much for partnering with CBS over the years and really deepening that partnership in this last year. I want to start off by saying I am not a medical doctor. I feel whenever I come to things like this, I'm like, please do not call me Dr. Tan because people are going to think I can say something about phenotyping or novel gene therapy, and I cannot. I'm a sociologist. I specialize in critical race theory and community engagement and building inclusive systems. Those are the things that I specialize in. But what I wanted to say to you, Ms. Lanry and your team, is that I have become a student of sickle cell disease because of you and your team. And when I was here last year, I am keeping time, but Karen, please keep me honest. When I was here last year, even in this just short time of 1 year, there's things that I learned last year from the people in this room that I was able to take into Canadian Blood Services. So we're around 4,000 employees, and I was able to educate and inform and possibly change the course of direction of someone else's plan because of what I learned because of Ms. Lanry's team bringing everybody together here. So I'll share two of those things with you. And that's probably more important than the whole presentation, to be honest. Sorry, MJ comms person who put the whole thing together. So one thing was I learned about, I think he's gone. I think it was Danelle who did a presentation about employment and sickle, was it? Somebody did a presentation on employment and sickle cell disease. And I was listening carefully, and what I learned was that there are financial implications to living with sickle cell disease. There's a lot of planning, there's a lot of uncertainty, there's a lot of advocacy that you need to do in the workplace for yourself in trying to understand what that looks like in terms of benefits. And something happened a couple of months ago at Canadian Blood Services where our partnerships and philanthropy team came to me and said, oh, we have these funders and their priority for the next few years is health equity for Black populations. Is financial and economic equity and inclusion for Black communities. And she was saying to me, it's just a shame because I don't think we're going to be able to get any funding for our sickle cell disease initiatives because it's not related to this. And I said, hold on a second. That is incorrect. And I immediately was able to say, listen, I know that is incorrect. There is way more to do with sickle cell disease than only health equity. There are financial and economic implications. If there's funders out there, I'm not saying they're going to fund it, but there's more research you need to do because you do not know the full story. And I would have never come across that perspective in an academic journal. Never. It was only from being here. And then the second one, now I've completely forgotten what it is. Maybe it'll come back to me. I'll go to the beautiful deck that MJ Deschamps has put together. So this is me, I'm Eloise. Only my mom and my uncles and aunts call me Dr. Tan because they like to. I have no conflicts of interest. So Canadian Blood Services, all I wanted to highlight here is despite our name, we are also responsible for plasma, stem cells, and organs and tissues for life. And what I want to do here is shout out our table outside, especially, is anyone here between the ages of 17 and 35? You don't have to put your head, it's like, okay. If you are between the ages of 17 and 35, you can go out there and learn about swabbing for stem cells. I think you can you swab today? And so you can swab and become part of the stem cell registry today. All you have to do is swab. And our team outside will explain to you what that means, what happens to that swab, what it means that you could possibly be saving a life further down the road. And we are particularly trying to increase the amount of stem cell registrants from African, Caribbean, and Black communities. Okay. So this is our vision, to help every patient, match every need, and serve every person in this country. How does that connect to supporting the sickle cell community? So if you look on the left, 15,000 units of blood are transfused to people living with sickle cell disease in Canada. There's a number of treatments for sickle cell disease, but blood transfusion, as I don't need to tell this audience, is the one that's most common and most accessible. But it takes the number of units for one sickle cell disease patient. We were at the UHN blood bank a few months ago in March, I think, right around the corner. Does that mean I have 10 minutes or done? Okay, cool. And they had these fridges at the blood bank. I think there was 2 or 3 of them, specifically dedicated to thal and sickle cell disease patients. And one of the people on the panel earlier said sometimes images just stick with you. This image really just stuck with me because in those fridges were trays. So the medical doctors here will probably know what the right words for all the things I'm saying. I just call them trays and fridges. There were these trays, and at the front of the tray was a patient's name, a sickle cell disease patient's name or a thal patient's name. And sometimes the patient had more than one tray that needed to be filled. And sometimes those trays were not filled yet with units of blood. And those units of blood were coming from multiple different places, as you can see on the multiple different people. And the people working in the blood bank were, obviously, they're professional, they deal with this every single day, but they were talking to us, and I think Ellis was there as well, and Ellis is our Director of Stakeholder Engagement. If you want to partner with us, go find him. And they were talking to us about, the work that they do every day to make sure those trays are filled. And how sometimes they have to make choices. If that tray isn't filled, what do they do? Right? And there's complexities in the matching of those trays. And so that sticks with me every single day when I come to work. I have a number of things in my portfolio at CBS, but I really believe that the sickle cell community is what gives me purpose every single day when I go to work. I think about those trays, and I think about how can we, in the Inclusion, Sustainability, Engagement Division, make sure that we're bringing more and more African, Caribbean, and Black donors in, having safe, positive experiences in our centers, so that they can continue to be part of Canada's lifeline. Probably other things I should say here. Yeah, so, and as you probably know, it's not just Black donors that can contribute to the blood transfusions for sickle cell disease patients. We also have, through phenotyping and genotyping, we can identify donors from other ethnic backgrounds that can help patients that live with sickle cell disease. But as you'll see later on in the presentation, we have the smallest number of donors that come from African, Caribbean, and Black communities in the country as compared to the population in Canada. So the title of this was something about doing something different. So we're trying to build a more diverse blood system, and we're being very intentional in that. The keynote speaker today, who completely blew my mind, right? I think we could have had Q&A with him the whole day. Talked about you need to look back before I don't know what the next part was, but he said you need to look back. So I made sure that we had this slide in, because why is this important? So this is I thought it was the CEO quote. Well, there's also, our CEO, Dr. Gramshare, has acknowledged systemic anti-Black racism in Canadian Blood Services. Now, why is that important? Because I didn't want to come here today and just say, oh, look at all the things we're doing at Canadian Blood Services. It's really important to acknowledge that we did not get things right in the past. And we did not get things right in very, very big public ways that resulted in the discrimination against people who primarily come from African, Caribbean, and Black communities. I'll get to that in a second. The other thing I wanted to say about this acknowledgement was there were some questions this morning about anti-Black racism. And it's also part of, actually it's Karen and our team's job. It's we have to sit with our almost 4,000 employees and help them, who are largely 70%, I think, identify as white in our employee base, who we need to help them make sense of what does it mean to acknowledge systemic anti-Black racism in the organization. I don't want them to just say, okay, I went to a training course, that's it. I need them to understand, move past feelings of resistance, guilt, all of those things, to actually sit with what does it mean for the work every single person does at Canadian Blood Services when we acknowledge anti-Black racism. And that's not work that I can come and say, I'll be back here next year and say it's done, because it's just not how that type of work happens, but it's something we're committed to doing. So one of the things that I think someone else is going to talk about it today, and it's been widely documented in academia, is about our malaria criteria. So this is probably the intersection of activism, advocacy, that I wanted to draw attention to today. Because there's a way I could tell this story that, oh, you know, Canadian Blood Services, we evolved our criteria, we're becoming more inclusive, things like that. It's leaving out important actors in the story. There were activists and advocates who were from Black communities that consistently knocked on our door, shouted outside our offices, wrote to the board, wrote to our senior leadership. I can't stand here and say that those people were not part of this story. They were integral to this story. They are integral to this story. And actually, I feel gratitude to every single activist and advocate, because they are helping us push towards becoming a better system for Canada, right? And for everybody in this room. So I know that we tell this, you know, different Canadian institutions tell their stories differently about becoming more inclusive, but I think what we often miss is the gratitude towards the people who made us uncomfortable enough to change, right? We didn't just stand up and say, we would like to give back more power, or we would like to do this or that. It's because people, like the people in this room, push those systems enough to do that, right? So I just want to say that that is the intention we're bringing to the Inclusion, Sustainability, Engagement Division, and I hope that, you know, if you had other ideas in your mind about how CBS works, we're trying to do things differently, authentically, and that's the spirit in which we're working, moving forward. I think I am good in time. So, nothing about us without us. We can't do this work alone. There's years and years of community-based research partnerships between CBS's Dr. Jenny Ha and Sickle Cell Disease Association of Canada's Ms. Biba Tinga that goes back and back and back, documenting what the barriers are to inclusion for blood donation for African, Caribbean, and Black populations. And we continue to draw from that research. There's actually an active research project going on right now that's funded. I see you, Karen. I really want to highlight this to people, the second point. So we've heard from community this message about nothing about us without us. And so we've been working with a consultancy to try to figure out what, it's not even like we haven't launched the search process yet to start the African, Caribbean, and Black Advisory Committee. We're trying to set the parameters of like, what would the responsibility of CBS look like? What would the responsibility of the advisory committee look like? But by the time this summit happens again next year, we should have our inaugural committee in place, and that will be an open call. And we will definitely reach out to SCAGO to publish that open call when it happens. We're working with recruitment advocates from Black communities, I believe some of whom are from SCAGO themselves, to create some community-led blood drives throughout the year. And we're also, like I said, we have an ongoing collaboration with SCAGO, and one of the things we did this year for the very first time in February during Black History Month, Miss Landry and Ellis and both of their teams planned an amazing event at the Mars Center in downtown Toronto. We're doing it again. We are doing it again. We're doing it again in 2026, and we hope that you'll all, if you're in the area, that you can stop by as well. And it was a beautiful night of celebrating caregivers and patients, and there was art and spoken word, and it was a wonderful event for the community. So I said this already. Okay, one quick question, and then I'm wrapping it up. This is my second last slide. Does anybody want to guess how many donors we have across the country from African, Caribbean, and Black communities? What did you say? 600. 600? Anyone else? Just shout it out. 200. 200? One more? 5,000. 5,000. Oh, who said 5,000? that's where I want to be. We are at 2,470, something like this. Yeah, 2,000. Yeah. So we literally track this number on a quarterly basis, and it goes up in front of our executive team. We're at 2,400, and the goal is to be at around 5,000. And you are all a part of the goal to get there. It's not impossible at all. So the last thing I'll say is, how can you get involved? If you are eligible to donate and want to learn more about donating, please, please, please do it through SCAGO's Partner for Life program. So that's what I'll leave you on, because you can obviously go in and donate by yourself, but when you join SCAGO's Partner for Life program, it just helps us better track the success of the partnership, and it's just another testament to the wonderful advocacy that SCAGO's doing. So thank you very much for listening, and that's it.
So am I on? Hello? Hey, okay, good. Okay, there it is. Is that my topic? No, I gotta go forward. Did I go too far? Hello again. I have already been introduced. I am Rugi Jello from the Atlantic Provinces. And my organization is Sickle Cell Disease Association of Atlantic Canada. I do not have any conflict of interest, so I'll go ahead. So that's my topic for today, which is sickle cell. I have to position this way. I was expecting a computer in front of me, so I have to adjust myself. Let me go. So the topic I have here today is the sickle cell blood donation awareness, engagement, and diverse donor increase in Atlantic Canada. By me, Rugi Jello, and I am the CEO of Sickle Cell Disease Association of Atlantic Canada. This topic is actually a proposed project that my team have in mind to celebrate Sickle Cell Disease Month in September. So it is a proposed project, and that's what I'm going to discuss today. This hasn't happened yet, although as part of our organization, we have been doing this for many years. This organization started before, way back, I think it's 2003, as the Sickle Cell Disease Association of Nova Scotia. But what we did, we expanded our mandate to include Atlantic Canada. Atlantic Canada includes 4 provinces: Nova Scotia, Prince Edward Island, New Brunswick, and Newfoundland and Labrador. This is the outline today. As you can see, there will be a quick introduction, the proposed project objectives, and understanding sickle cell disease. This is in the Atlantic context, how it is. I know, sorry, this is a little bit awkward for me. I wasn't expecting this. I do apologize. I usually like looking in the eyes of my audience, but I am not going to be too, yeah. Oh, thank you. That's a whole lot better. Sorry about that. I am one of those eye catchers. So that's my outline there. I will go through them quickly, but I'm going to focus a lot on African Nova Scotian and other diverse communities and the engagement strategies that we have in mind to be able to achieve our goal, which would be getting Black donors in our African Nova Scotian communities, African Atlantic communities, which will include African Caribbeans, people from other diverse communities such as Southeast Asians and Middle Easterners. That's the huge community, diverse communities we have in Nova Scotia, including Caribbeans. So for our introduction and purpose, blood donation, as we know, as everybody has said, Dr. Tan just mentioned, it is not just important for sickle cell disease, but it is highly crucial for the patients because it prevents strokes, reduce severe pain, and also preserve the organs to be healthy. So we can do this by increasing blood donation from ethnically diverse donors to ensure that we have better matched blood and better outcomes for our patients. And as I had already mentioned, with Atlantic Canada, sickle cell disease is there. It's not as large as it is in Ontario, definitely. Ontario is the mega province of Canada. It's not as big as it is in Western Canada, but sickle cell disease, it is prevalent in the Atlantic provinces, and it is increasing, mainly because of the universities we have, especially in Nova Scotia, Halifax. We have Dalhousie, and there's Moncton, Université de Moncton, Newfoundland, Memorial University. Memorial University has become such a big attraction in the world for other students to come there because it is supposed to be one of the cheapest universities in Canada. That's one of the reasons, and all of the other universities, the numbers of sickle cell is increasing in Nova Scotia. So what we are doing with these projects, first of all, we have to raise awareness of sickle cell disease, and then to encourage diverse donor participation and highlight the needs of sickle cell patients. The proposed project objectives, as I said, we have not done it yet. This is what we're doing. And I am so glad that the previous folks mentioned about the village. So our village is huge. We have a lot of collaborators to make this happen. So one of our objectives is to raise awareness of sickle cell disease, at the same time promote culturally appropriate blood donation. That's going to be the focus of this project that we're going to have in Atlantic Canada. This project will actually increase diverse blood donors. Understanding sickle cell in Atlantic Canada is very essential. It is crucial because Atlantic Canada is different. It is, as I had already mentioned, those why it is increasing, but the challenge is that we have a smaller population compared to the bigger provinces. So we also have to understand that we need to access appropriate treatment options, which can be a challenge sometimes, that we are going into that later. But there is the ongoing need for blood transfusions. That's why we are really promoting blood donation from diverse communities. Why do we need blood donation from diverse communities? It is important because we need to match sickle cell patients with diverse blood donors because of the demographic in Atlantic Nova Scotia is really small when it comes to diversity. Most of our blood donors are European descent. And there are gaps in meeting patient needs, including the antigen compatibility. Maybe if you have questions later, Dr. Tan and other folks from CBX will speak to that. The diverse blood donors matter, as I had mentioned earlier, due to the antigen matching and due to the antigen matching for blood donation. And then the risks and complications from mismatched blood is greater. That's why we need to encourage people from African descent communities to donate. I wanted to focus on this because all of the other items other folks have already talked about, but this is the item that I find very crucial in Atlantic Canada. That's the African Nova Scotia communities and then the diverse communities in Atlantic Canada. But for African Nova Scotia, I'm not sure how many people know that, but we have over 400 years of history of black people living in Nova Scotia after the slave trade, when they were all shipped to Nova Scotia as free slave trade. As freed slave people that have freed from slavery. There are actually about 52 historical communities, Africville, Cherrybrook, and many more. the minimum number, the numbers for sickle cell numbers within the African Nova Scotian communities is actually very small. And we can trace that back to the history that the keynote speaker gave us earlier in terms of malaria. These people came, well, originally from Africa as slaves into North America, the Americas. They fought the war and went to Nova Scotia. So they were really not exposed to malaria or mosquitoes or anything like that. So their level of, the numbers of sickle cell disease is very small. However, there are still quite a few. Right now, we have about 3 individuals in our group in Nova Scotia who are originally African Nova Scotians. So these are the other communities that we are going to focus on. First of all, the Caribbean community. The Caribbean community is huge in Atlantic Nova Scotia, in in Atlantic Canada, in Nova Scotia, PEI, Newfoundland, they're all over the place. And what makes the Caribbean community unique is that, unlike West Africans, they do not have history of malaria. They have been able to get rid of malaria, and they are malaria-free. They can actually donate as opposed to West Africans. And then the largest group that has sickle cell disease other than Africans, Caribbean, is Mediterraneans, Southeast Asians, and some South Americans. So our engagement strategy would be to actually reach out to the communities and encourage them to be able to donate blood and increase black blood donors. We can do that by having educational campaigns in the communities, and we are going to partner with the community groups, churches, mosques, and all of the other little groups that we have in the Atlantic provinces. What would be great as well would be to provide incentives, recognitions, and other, to make sure that their donor habits is long-term. It's not just that time, but they continue to donate blood. There are many challenges, one of them being in data and resources. In resources being that doctors. One of the things that we lack in Atlantic Canada is hematologists. We can have patients in the hospital. For them to see a hematologist, it can be very challenging, and the data is not there because of one of those reasons. You cannot have them just provide information from the hospital about the patients. Then blood donor diversity. Most of the donors in Atlantic Canada are of European descent, and because one of the reasons being that that's the larger population we have, and black people do not donate. I'll just move forward with this. So call to action, because that's crucial for us. Call to action would be ways to donate. What we are looking to CBS for, which other ways to donate as opposed to the traditional way of going to the place wherever you have to donate. In Halifax, there are a couple of centers, I believe 2. Can we get them to go to churches? Say, for example, in Nova Scotia, most of the black folks there from Nova Scotia are Baptists. We have had blood drives just after church, and it has been so successful. So we have to get out of that normal routine, go and donate blood. How can we send our messaging that fits the community? Because that is what we need to increase blood donation in the Atlantic provinces. Nova Scotia is just one. We have them in many places. In New Brunswick too, we have a large number of black folks. But even within Nova Scotia, we can separate that out in regions. Say in Cape Breton, the black population in Cape Breton that are originally from Nova Scotia is huge. What strategies can we put together to make sure that these individuals donate blood? We have to get out of that traditional mode of donating blood. How can we send out the messaging for them to donate blood? How can we talk to them first, engage with them first before we send the messaging out? You can join us in September to actually see the work that we're doing in Atlantic Canada. That might be a learning point for many of us, and that's an experience we'll have to share again whenever it's possible. You can volunteer, advocate. There's advocacy opportunities. We can do that in the Maritimes. And what we have been doing is working with SCAGO a lot. Right now, there's a youth program going on, and we are working with the SCAGO office here in Ontario, in Atlantic provinces. That's also a way that we can learn from one another. Those are our partners. Let me just give you a list of our partners that we're working with, which is our village, Canadian Blood Services, IWK, the Health Association of African Canadians, United African Canadian Women's Association, the Community Masjid Center in Halifax, the African United Baptist Church. Most of the Black Nova Scotians belong to that. So once you tap into that, you get to get them actually. And then the Jamaican Cultural Association in Nova Scotia. Thank you. That's okay.
So good afternoon, everyone. So my name is Tanya Elese, and today I will be talking on equity and inclusion in blood donation, and I will focus on the right blood for every patient. I'm the Southeastern Region Chapter lead for SCAGO, covering Ottawa, Gatineau, and around. Just to disclose that within the last 24 months, I'm volunteering with SCAGO, but I did had supported, received honorarium as well, so I just wanted to mention that. Very quickly, and I'll stick to my slide because if I start talking, I will keep talking and we never, I will give headaches to Karen. So, so coming back to what I want to present today, I want to talk about a critical action that we can take, which is to build a more equitable and inclusive blood donation system for all Canadians. And this is not just about policy, it's about people. Like we said, we are treating with humans, so it's about people. It's about ensuring every patient with sickle cell disease has access to the best possible care, and that every member of our community feels empowered to contribute. So it's for our little Isabella that we can see on the slide, or for my son, Elikia. For many living with sickle cell disease, blood transfusions are not a last resort, they are a lifeline. These transfusions are crucial for managing symptoms, preventing complications like stroke, and improving quality of life. But it's not just about getting the blood, it's about getting the right blood, and as it was said before, and a close blood type match goes beyond the familiar A, B, or AB, or O types. It involves a matching of a variety of inherited antigens on the surface of the red blood cells. So for patients who require frequent transfusion, because this is one of the treatments with sickle cell, a close match from a donor of similar ancestry is essential to minimize the risk of serious complications and the development of antibodies, which make finding future compatible blood even more difficult. Since sickle cell disease disproportionately affects individuals of African, Caribbean, Black, Middle East, and South Asian ancestry, the need for a diverse donor base is crucial. This is just a very quote that I found online and I find interesting. This is from Smita Pakel, who's a professor at University of Ottawa and clinical research chair in equity and patient engagement in vulnerable populations. Sickle cells block small vessels, we know that, causing intense pain and serious complications. The risk worsen when transfusion don't match the patient's genetic profile, so hence the importance for receiving the right blood. I wanted to talk also about the historic barriers. Both Karen and Dr. Tan spoke about that, so I will try to go very quickly through those. So we heard that there was systemic barriers that have deterred Black Canadians from donating blood. So for decades, screening policies created significant hurdles, and many felt excluded, misunderstood, and untrusted. And I wanted to share, for example, the story of my own nephew. This happened 20 years ago. So he was a young man in college and decided to join his friends at the campus blood drive. What a good thing, right? So he waited patiently in a long line, only to be told that he was ineligible. Not because of a medical condition, but just because he was born in the Congo. So even though he had lived in Canada since he was 4 and had never had malaria at the time, the policy was simple, a strict no. I remember when he came home, he felt disappointed, he was furious and ashamed, feeling ostracized because of his origin. That's it. So this is the kind of legacy we have worked to overcome, because today it would have been eligible to donate. Another quote that I found, which is, current blood donation rules effectively exclude people from certain backgrounds, yet thousands rely on blood from those same communities. They are the ones paying the highest price, a double injustice with no real scientific basis. So those are the things that are being, and on the other slide you have the history, but I'll go quickly through that. And most important now is the actions. What do we do? So the good news is that we are seeing progress. Canadian Blood Services is actively working to dismantle these barriers. We've heard it before. So they are reviewing policies, engaging with community partners like SCAGO, and acknowledging the importance of diverse blood supply. However, our work is far from over. This is where our actions today become the cornerstone of a healthier tomorrow. So education and awareness is really important. We need to continue to educate our community about the evolving eligibility criteria and the critical need for their donations. I remember, Jane, I'll put you on spot. We wanted to organize a blood drive for Black Month history at a time. And Jane was like, but people can't because of malaria, or they can't because of the country they're coming from. And someone reached out to them, like, you're advertising that, but we cannot even donate. And it was, no, it's not because of your country. Yes, if you had malaria, but you can donate plasma. So those are how we can educate the community. It's important to share that while, like I just said, while the world blood donation is restricted for those with a history of malaria, they may still be eligible to donate plasma. We must counter these cultural perceptions with facts and personal stories of impact. This is particularly important for encouraging the young Black ancestry generations born here in Canada who are less likely to have been exposed to malaria to become lifelong donors. And I'll just go back still there. There are also other initiatives that we can make, like the blood drive. Like we said, we had one during the Black History Month, and we need to do more of those. You can, at your work of place, have lunch and learn, where you educate your colleagues on sickle cell, but blood donation as well. We can have info session. Canada Blood is already willing to come to our churches, our mosques, our small community to share and speak about that and help us break those barriers. We must continue to partner to create welcoming, culturally competent donation events that bring the service to the community. And of course, advocacy. We must continue to advocate for equitable policies at all levels. This includes pushing for further research to remove unnecessary deferral criteria and ensuring that our voices are heard in the policy-making process. This is a young man that is proud to be a first donor. That was done at University of Ottawa. And I saw that slide with Dr. Tan. I was impressed to learn that it takes 50,000 units of blood 50,000 units of blood are transfused to people living with sickle cell disease in Canada. Our role as community leaders, as members of SCAGO, we are at the forefront of this change. Our role is to build bridges between our community and the healthcare system. We are the storytellers. We can share the powerful testimonials of patients whose lives are changed by transfusions. Not later than last February, my son had 3 packs of blood, and you just there at CHIO, they noticed that he needs blood. It comes for me just like this. But hearing today that sometimes we give headache to Elise that he doesn't know even where that blood will come from, for me, those are things that I didn't know. I will see him receiving the blood, and I'm just thankful for that. We are the educators. We can host information sessions and Q&A forums to address questions and fears of hesitancies about the donation process. We are the organizers. We can continue to organize successful blood donation clinics, making it a routine and celebrated act of community and solidarity. Please note that when donating using our PFL, I will call it, which is the Partner for Life ID, SICK 327620, this ensures that your generous blood donation is counted toward the sickle cell disease community's impact. By taking these actions, we not only increase the number of diverse donors, but we will also build trust and reinforce a sense of belonging in the wider healthcare system. So in closing, shaping a healthier sickle cell disease community tomorrow requires us to address the systemic inequities of today. The act of donating blood is more than a simple procedure. It's an act of service, it's an act of solidarity, and a profound way to save a life. By championing equity and inclusion in blood donation, we ensure that every member of our community has the opportunity to give and the assurance that they will receive the care they need. Thank you for listening.
I think I turned it off. So I want to say thank you to our wonderful panelists, but now we get to see me put my steps in today with all the wonderful questions that I'm going to be feeling from the audience. So I'll start off by seeing if anyone has any questions for our panelists today. I'll try not to trip and embarrass myself.
Thank you. It's good to hear the work being done. And I just had a question around like a campaign around improving blood donor services. So I've heard about people's inability to contribute from the LGBT community, from the Black community. Those are the stories you hear. So I'm just wondering, like, I just think about like larger global campaigns and why wouldn't be considered from an equity seeking group to do something like that. Because I can tell you, like, blood, it's in you to give. Like that, I know that from the campaigns you guys have done. So I'm just wondering, community work is so important, but I think there's so much misinformation because people have shared their experiences through word of mouth, and we're a community that's often based out of storytelling. And so I'm just wondering about the ability to actually do a campaign that talks about some of those pieces at a national level.
Eloise, you know this one's coming for you.
Thank you very much for your question. The person best placed to answer is sitting right beside you. Her name is MJ Deschamps, and she's our Associate Director of Community Relations, and she runs a lot of similar campaigns to what you referred to. But no, it's okay. I won't make you run again, Carrie. But I will, or maybe MJ could say something, but I'll start by saying, so I hear the word misinformation a lot at CBS from my colleagues and from outside, and I always try to pause when I hear that, because is it misinformation or is it, yeah, it's a legacy, right? Because I don't want to discount we can't brush past our past, right? So there was definitely an era at Canadian Blood Services where there were discriminatory policies against US LGBTQI plus communities and African, Caribbean, and Black communities. So if somebody has a story here, you shared a story from me, that's not misinformation, it's a legacy. And like you said, like our communities are built on storytelling. Right. So it's a legacy, and it's not, it's myth. We hear a lot, myth, like this is a myth and things. It's like I also pause when I hear that. I don't think it's a myth. I think it's a legacy. It's a story that happened at a time, and if it would happen today, it would happen differently. At least that's what I would hope. And if it wouldn't happen differently, then I would hope that people would at least trust Canadian Blood Services enough to contact us so that we can do better on that, so we can address that. So, actually I remember like one story I heard at this summit last year, and also at a he's not here anymore, but an NRBDO event was about drawing blood from, somebody had shared a story, they were Black, they had went in to donate blood, and the person said, I can't find your vein, or something like that. And so, like, when we had that information, so I went back to the VP of Collections and I said, I've heard this story now at 2 or 3 community gatherings. Can you look into this and make sure it's addressed in your training? Yeah, so it's not anyways, I'm harping on the misinformation, but I just think it's important because I don't want to gaslight people. And you're absolutely right. That's what you hit on. That's our biggest challenge and our biggest opportunity right now. We are making the changes, but we have to find ways to make people aware of them, and we cannot do that without communities because they're not, like, it's all based on trust. So without the people on this panel, without this people in this room, we need to work with you and through you and resource those people so that they can help tell our story in their own words. But I appreciate the question, and you should talk to MJ afterwards. She's got the answers in a work plan somewhere.
I thought I saw another hand coming up. Come on. Sure.
Yes, well, I really like what Dr. Tent said. It's not a misinformation, it is happening. So we had a blood drive in Halifax not too long ago, I can't recall when. A lot of people showed up, and they mostly from West Africa. So they were turned back, they couldn't donate because they come from West Africa, although some of them said, I am born Sierra Leonean, Guinean Sierra Leonean, I've never had malaria in my life, I have sickle cell disease trait. So when the keynote speaker was, I said, okay, when people say malaria, I've never had malaria, but I still cannot donate because I am protected against malaria. A lot of those men, they had, it was in the summer, actually it was last summer, and I recall, they had barbecues to go to, they didn't. They went to donate. They were not allowed to donate, although some of them said, I never had malaria. I know that they had sickle cell trait. That's why they didn't have malaria. They couldn't let them. So it's not just a legacy, it's still ongoing. And these are issues that we as a village need to address. Thank you.
I'm looking for hands. Okay, well then I'll take the floor and I'll ask a question. So I have a question here for Tanya. So what exactly is the Partners for Life program, and how does the PFLID hashtag SICK 327602 make a difference?
Thank you. So the PLF, the Partner for Life program, it's a program from Canada Blood that help groups or communities to really have an impact in the donation. So when you use that, I believe when Dr. Tan was talking as well, she was like, go to donate and it will count for the sickle cell community, but you have to mention, if you know that that number, it will be easier to show up and say, I want to partner with SCEGO. So that's a way. And those are the numbers that also help Canada Blood to know, like to have tangible data on how many they are receiving to count for the sickle cell community, and also to increase the equity as we would like it.
So I seem to be asking all the questions here today, so I have one for Eloise now. So Eloise, we've been hearing a lot about this malaria criteria, and I've just joined CBS 2 months ago, and I know we have some things in the works. Tell us more about that. Why isn't it out here yet? Especially since we had SCEGO today talking and wanting Black people to come and donate their blood. Why?
Thank you, because that's the one thing I forgot to mention in the deck. It was on the deck, but I didn't talk about our NAT testing criteria. So has anybody here heard of NAT testing before? So NAT, N-A-T, stands for nucleic acid testing. And so it's a I feel like you know exactly what it is. And you're staring at me and I'm not going to be able to describe it very well. But basically, it's going to be a test that's going to allow us to change the malaria eligibility and still maintain the integrity we have over the quality and safety of the blood supply. So right now, like if you think of the questions, if you've ever been to try to donate or to donate, you're asked a bunch of questions. Those questions are actually like they're proxies. They're substitutions for things that if we had tests to run on the blood, we wouldn't need to ask you anything except for, are you feeling well enough to donate blood today? And then we could just run a bunch of tests in the lab and figure out what we can do, who we can match your blood with, et cetera, et cetera, et cetera. So there's a new test in Canada. It's not new. I should clarify that. It's not globally new. But Canadian Blood Services has submitted to Health Canada for the approval of the NAT test. And we have progressed to a certain stage. There's all kinds of different levels of approvals with Health Canada, but we are on track to be able to roll this out as of 2026. I don't think that's like January 1st, 2026, but sometime in 2026. And when we do, of course, we're going to send SCEGO all the information. We're also going to work through our then established African Caribbean Black Advisory Committee to get the word out to community. But this is a critical piece of increasing the inclusion of Black communities. So thanks. I was kicking myself for not talking about the NAT test because I know, it's literally the most important thing for people to know. Thank you. Did you want to say anything though? No?
Thank you, Eloise. Rugi, I did not forget you. What I love about my 3 panelists here, that they just seem to be so connected. You know, we have different levels. We have on the ground talking about the patient experience and all of that. We have those who have that lived experience through their families, and now they're doing something, trying to bring in recruitment, and then we have the system here in CBS. So, Rugi, I'm so interested about this work that you want to do, that you're looking for sponsorship for. So could you tell us a bit more about how you intend to go about recruiting people and bringing our donation numbers up, especially from this critical community of African, Caribbean, and Black communities?
Thank you, Karen. I appreciate it. So we are going to do this through engagement. First of all, we need to engage with the communities. And that's not something that we can do alone. That's why we have our village. Now I stopped saying partners and I'm using the village. It's kind of cute. So our partners are the Health Association of African Canadians. They are huge in Nova Scotia. They started very small and they just became this big Black health organization that are actually have programs for many other conditions. So through them, we can reach the other communities. Through the United Baptist Organization, as I said, many of them, if not all of them, African Nova Scotians originally from there, Baptists. So we have all those pathways. We have the United African Canadian Women's Association. There's this Umar Masjid that's huge for the Middle Eastern community. So we have all these partners. Through them, we engage. We'll go to the masjid. My family is Muslim too. Dress up, go to the masjid, pray with them, which I do, and we talk to them as people. This is what we experience as people. What do we do? How do we send the messaging out? First of all, before we put that messaging out, we have to come together and discuss the messaging, how it should go out. We just cannot say, oh, here, that's with, CBS once, I said CBS, sorry. Canadian Blood Services, Canadians. Yeah, I did say CBS, yes. But I was thinking the TV station. We have all of this scripted messaging that goes out, which is absolutely fine on red and white, but that does not speak to everybody. That's why we said it has to be messaging that's sensitive to the community, messaging that the community understands. How do we script these messages? And we don't do it alone. They have to be on the table. Okay, this is this community that we're dealing with. How do we message this information? We have a discussion, they're part of it, and then we send the messaging out. So through that, we'll be able to meet a lot of the people and then encourage them. It's not just one day or one event affair. We have to make sure that it is ongoing. So it has to be a long-term relationship. That way it is sustainable, because we need to keep our blood donation coming in sustainable for our sickle cell disease patients. They're always there. Thank you.
I just want to thank our wonderful panelists for all the information they shared for us today. I just think it was beautiful. It was such synergy between these three wonderful women. And it just reminds me about this quote Eloise had up there saying, "Nothing for us without us." But I think what they demonstrated for us today is, if you're coming here to save me, then you're wasting your time. However, if you're coming here today because your liberation is tied with mine, let us work together. They are demonstrated where we need to go in partnership. Thank you so much to our wonderful women.
Come on, I need a better round of applause than that. Come on. Much, much better. Okay, so that brings us to the close of our concurrent sessions for the afternoon. We have a short break from what's that? Apologies.
Do you want me to take the question? I can take the question now.
Yeah.
Oh, okay.
It's a follow-up question on the NAT testing. Because when you hear the story of black people being turned away when they come to donate blood, and you say that the NAT testing, you've moved a step now. What is going to happen in your strategy as you make a drive to increase blood donation from black people? Because now people turn up to donate blood, and we need blood for sickle cell patients. And the NAT testing looks at the RNA and DNA of the viruses. Now, they assume that black people have malaria. So what's going to happen moving forward before this process is completed?
Thank you. Thank you for your question. So your question lets me talk about how there's a holistic process that's wrapped around this. And I can't say to you, I have all the answers, but I can say to you that we're thinking about all of the questions we need to think about, and that's one of them. So, for example, there's a team that's working on the rollout of the NAT test. And as you mentioned, it's also tied to, because we cannot apply the NAT test just indiscriminately across. We don't have the funds. So there's financial implications of instituting new testing as well, right? So one of the things that will be happening is we'll have to convene a group of people to actually work through what is the process by which we're going to first pilot the NAT testing. How are we going to decide who we pilot it on? It's almost like you're in that meet, like you are saying to me things that we are asking ourselves, right? Because we know there's issues that exist there, and it's not as easy as saying a NAT test is going to fix everything. Just because even if I'm listening to my panelists and the experiences they shared. So there's two things. There's a legacy, so people still might not come in. And then secondly, there's the very real possibility that they can come in and still receive discriminatory treatment, right? So we have to address that at the frontline level, which makes it almost mirrors the conversation this morning of what cultural competency, anti-Black racism training, education needs to be provided for healthcare workers. CBS clinic staff are not healthcare workers, but they also need that same cultural competency, anti-Black racism training, and then keeping the frontline workers accountable to those standards of care. I'm using language that's more applicable in a hospital, and we aren't in hospitals, but I think you understand what I'm saying, right? So what I want to say is I can't sit here with all of the answers, but I can assure you that we are aware of the questions we need to ask ourselves. And then also by standing up the African Caribbean Black Advisory Group, these are some of the questions that we want to work through in partnership with some of those folks in the future. Thank you.
Okay, let's do this one more time. Round of applause for the panel.